While on placement, I wanted to do more to engage service users to get outside into nature rather than sitting around feeling glum, drinking copious amounts of tea and coffee and snacking. I drew on my own coping mechanisms to beat the blues and wanted to share my strategies with staff and patients. I learned about the transformative power of dance many years ago when I did a degree in dance and psychology with a view to becoming a dance therapist, and felt that on a few of the placement this was the only option left, as clearly medication wasn't working. But the challenge lied with convincing others. I felt the only way I could do this was with results. So, on my second placement, I eventually found the courage to use a therapeutic intervention that had not been used on this psychiatric intensive care unit before. One of the patients had been crying for days. He was in a great deal of distress. The medication simply was not enough. He was sobbing and praying throughout the day. I asked what he liked doing. He whispered dancing, which was surprising. He was a city executive. I took him outside and suggested he dance in the sunshine, which he did. And within minutes he stopped crying and eventually smiled. The challenge here was that it was a PQ ward and the intervention had never been used. I was nervous in adopting the strategy, but was desperate to reduce this patient's distress. Staff were delighted with the results, and this patient made a record swift recovery, according to the clinical lead. He was even called their star patient. The intervention had worked, and 2 weeks after he had left, he came back and ceremoniously returned the trainers to me he had been lent on the ward, and promised he would carry on dancing. Another patient in an in-house community setting was shaking and crying all day, every day, ridden with anxiety. After my first week, I knew something had to be done. Nothing was working to improve her mood. Staff had made strenuous efforts engaging her in mindfulness, cookery, arts and crafts. She was, of course, on medication too. I asked permission to take the young lady outside into the sunshine, and we danced together. She was reluctant at first and embarrassed, but soon overcame her shyness. Within minutes, she was laughing, and I knew the therapy had worked. She'd promised she would use this in future as a coping strategy for very dark days. I wanted to use this medium in practice to help elevate patient mood, because for most it really works. But the potential challenges are convincing staff and service users that this is a therapeutic intervention which is effective. The clinical lead saw the results. I was asked to take 8 patients outside into nature with 2 members of staff accompanying me. We did, and returned to the unit an hour later, more than an hour later, with patients smiling and more relaxed than ever before. On an elderly ward, a man was told he's going to lose his mobility because he was so depressed he'd not left his bed for a year. The challenge was encouraging and convincing him to walk with me around the garden every day, and as much as we could, and gradually he regained his mobility. On my last day, I looked outside and saw him walking alone around the garden. He continued without me, and it was beginning to work. Potential challenges again was with convincing a reasonably frail at first gentleman that this would work, and overcoming his psychological barriers to doing something that was really simple and effective. But the results couldn't have been better. He was smiling. The challenges generally are that alternative therapies can be seen as challenging the status quo and deviating too much from older methods of simply administering medication. But my experience so far has shown that with most people, this works. So the overcoming the challenge really was in the results.